Only in America.
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 This week, a healthcare professional who has become like family to her patients, while her ability to work in the U.S. is at risk.
And, fellow immigrants and fellow undocumented people, the hard work is never going to stop. A pandemic is never going to stop the hard work either. They're going to get up every morning. We're going to get up every morning and continue to do our jobs. And I just think that's beautiful.
From the National Immigration Forum, I'm Ali Nirani, and this is Only in America. We've been taking a look at how immigrants are essential to our nation's health, contributing to our hospitals, healthcare facilities, medical research, and so much more. And we've heard about how their contributions are even more crucial now as our nation faces the COVID-19 pandemic. Today, we'll hear more about the toll the pandemic is taking on our mental health and how immigrants working in healthcare are part of that response. We'll also hear about the much-needed care they're providing at some of the places where the virus is spreading the fastest, senior living facilities. But first, let's talk about how a segment of those immigrants could be at risk in the coming months. The Supreme Court is set to rule on deferred action for childhood arrivals, or DACA, sometime this summer. DACA allows some young immigrants brought here as children to live and work legally in the U.S., for many, the only country they've ever known as home. If the court rules to end the program, it would leave DACA recipients, their families, their employers, and the people they care for at risk. The Boston Globe editorial board writes that, quote, roughly 27,000 undocumented immigrants currently protected from deportation through DACA work in the medical sector as doctors, nurses, and home health aides, among other healthcare professions. The healthcare industry is clearly not ready, they wrote, particularly during this emergency, to offset the loss if those immigrants are erased from the healthcare workforce. Today, we'll talk to one of these DACA recipients who would be affected, and the amazing, actually inspiring, work that she is doing during the pandemic.
Support for the National Immigration Forum comes from the Carnegie Corporation of New York, supporting innovations in education, democratic engagement, and strengthening international peace and security. And from Humanity United. When humanity is united, we can bring a powerful force for human dignity.
My guest today is Esmeralda Tovar, a mental health case manager and a medication aide at an assisted living facility. She's also a DACA recipient who has lived in Kansas since she was 2 years old. We had Esmeralda on Only in America about 2 summers ago, where she talked about her military family and her experience as a DACA recipient. She's clearly still speaking out about the importance of DACA and the contributions of dreamers like her. And this time, our conversation focused on her experience working in healthcare amid the coronavirus pandemic, as she waits in limbo for the Supreme Court's ruling on DACA. Her husband and 2-year-old daughter are both U.S. citizens, and she's only ever known the U.S. as home. Yet, a ruling to end DACA would leave her unable to work and susceptible to deportation. As she recently wrote in an op-ed for the Wichita Eagle, that would be a disaster for the vulnerable people I'm helping. Esmeralda told me about how she spends her weekdays helping people get the mental health care that they need, and her weekends at a nursing home's Alzheimer's and dementia unit with elderly Americans who consider her family. Esmeralda, thank you so much for joining. It is great to talk to you again.
Thank you so much for having me.
So just to remind the audience, and we might have talked about this the last time you were a guest, but tell me a little bit about yourself. How did you get to Kansas?
To Kansas. So when I was about 2 years old, my mom and I came over. My dad was actually already here.
Came over from
Mexico City. He actually came over a couple of months before we did, so he could save up some money to have us here. And we basically were only supposed to have a pit stop in Kansas. And we were supposed to end up in New York. And so, funny story, I just had no idea. I always asked my dad, hey, guess what? Why aren't we in New York? And he said, well, we just ended up staying here. You know, your cousins are here. We were actually staying with them at their home here in town before they moved to Wichita. We were all kind of living together, and we just never left.
So you grew up in Kansas, graduated from high school, and then?
Graduated from high school, and I went to college at Benedictine. And then I had my daughter, moved back home a little bit closer because I was about 3.5 hours away. And I applied for nursing school at KU. So that was very exciting, all of these things happening at the same time. And my very first year of nursing school was in 2017, August 2017. And that was when DACA was rescinded in September, the following month. So that kind of took a lot of toll, not just on me, but my family, just kind of deciding whether or not, like, what to do next. And so, you know, I finished out that school year, and then I decided to do nursing part-time and add a year so I could kind of do neonatal nursing. I was kind of baffled and amazed by everything having to do with NICU. And I figured if it's not my child, I should be able to do it. But, you know, with everything happening and the uncertainty of DACA, not knowing what was going on, it was hard. And so everything that led up to where I am today, I honestly think it's just a way of God telling me, you thought you had a plan, but I have something better for you. What ended up happening was with DACA, I decided that maybe I could take a step back from nursing because I had come into my second year of nursing and my DACA had actually expired. And I had sent in the paperwork for it and everything, but it didn't come in time. And I had to start driving again and stuff like that. So I didn't really want to drive out of town, you know, with a license that was expired, because our licenses, they expire when our DACA expires. It's not like any regular license like my husband. And the funny thing is that my actual work visa was issued the week before. Like, so I had turned it in, all my paperwork, and the week before I was supposed to start going back again, it was issued, but I didn't get it until 2 weeks later. And so that kind of put me in even more limbo. So I actually got to experience, I was completely undocumented, had no valid driver's license. I couldn't even pay for my insurance or, the tag office. I needed my license. So my husband had to do that. We moved some stuff in his name so that he could do it. So we were both kind of co-signers until I could get my paperwork in. And I couldn't go to work. I couldn't go to school. So that kind of put me in a bind, per se. I decided to take a step back from nursing there. And the wonderful thing about that is that social work came up. There was a job available at the mental health center here in town. And I read through it and I realized that I had the education required for all of that. And I went for it. At that time, I was working full-time at a nursing home here in town as well as a medication aide. And when I got a job offer there at the mental health center, I was just, completely excited and surprised because I didn't, I love social work. I have never really been in it though. And so with my other degree that I'm working on at WSU, which is Wichita State, it's criminal justice, sociology, and women/ethnic and religion studies. So as soon as I'm done paying off for the past semester, since we have to pay in full, it's pretty much out of pocket since we don't receive the financial assistance from the government. DACA recipients pretty much have to figure it out on their own. And that's what I've been doing. paying out of pocket, and little by little, I'm getting close to graduation, hopefully here soon, with that next degree. So anyways, going back to working at the mental health center, it has been absolutely amazing. We have clients who have several different things going on, and we basically help keep them in our community, kind of ending that stigma that mental health is a bad thing. If you have an issue with mental health, that you're considered a bad person, and that's completely not true. So that's kind of what I do right now. And I'm also a part of Hutch and Harmony. And it sounds so pretty when I say it that way, Hutch and Harmony. It is a nonprofit organization. They have held a lot of rallies and they've held parades, and they've helped out with many community issues that have arisen here in our community in general that are specific to our community. That's just a little bit about what I do.
So then when did you get your DACA status renewed?
I got it renewed, let me see, this was last year in 2019.
Got it. Do you look back on going to nursing school? Is that something that you want to return to at some point?
I think eventually I will go back to it. I still have a love for nursing. A lot of things that I remember from school are, still things that I use today, like, at work, even when I work on the weekends at the nursing home as a medication aide. Obviously, a lot of those medications that they take, you need to know the side effects and things to look for and all of that. And so I still think it's very beautiful. And I've always kind of sucked at science. Like in high school, I could do it, but it was hard for me. Unlike math, where I did not like it, but I was good at it. Mm-hmm. It's the complete opposite with science. And that's why I love it, because it challenges me.
Well, in my case, I'm good at neither. So what is it like these days in the midst of the COVID-19 pandemic in either job, whether it's as a mental health case manager or working at the assisted living facility? What is that environment? What are the things that you are seeing? What are the feelings that you're getting from the patients that you're helping?
It has been very difficult for both my residents and my clients, mainly because, the only way really that a lot of my clients will be out and about in the community and being able to have that time to to walk around, to talk about things, to kind of be in a more relaxed setting, it's in the community. And so without me being able to take them places, whether it's, for like a snow cone or it's their birthday or like their favorite donut shop or whatever it is, it's been difficult. So we have actually implemented telehealth with our clients, and, not a lot of them are able to download Zoom, which is the video conferencing that we use for work. So it's just phone calls. And so you kind of have to find a way to make it interesting, but you can definitely see the struggle there, being able to say, hey, how are you? It's like, honestly, not good. I wish I could be able to see you. Honestly, I wish I could go here and I could go there. And because we're all, not able to, I think it's the only thing that's helping. It's like, okay, so maybe it's not just me. It's not just my fault. It's, we're all going through this pandemic. And with my residents at the nursing home, it's definitely been difficult because family has not been able to come visit them. And I think that's been one of the hardest things, because if you don't remember a lot of things, specifically, I work in the dementia Alzheimer's unit. The only thing that you remember is, okay, Sundays are family days, right? A lot of family usually comes on Sundays. And it not happening for a couple of weeks now, it's been hard. And so being able to be that person and, that community within our community there, we've kind of gotten really close and trying to figure out ways to kind of help facilitate what they're going through, because you have to understand that if a resident is upset or anxious, lashes out or whatever it is, it's not you. They're going through things and we're going through things as well. And so being able to be that safe haven for them and let them know, hey, like, I'm here for you. What would you like to do? Do you want to go outside here in the little patio where it's enclosed? anything to kind of help them go through their day by day. It's still been difficult though.
And as you're helping people, do you think that the experiences that you've had as an immigrant, as part of an immigrant family, being undocumented, being recipient of deferred action, how did those experiences, which are very difficult and challenging experiences, how do those inform the interaction that you have with the patients?
I think I look at them as my own, just because we have such huge respect for our elders, especially in, at my home and just in general. We go to them for everything, and I wish I could do that with my own grandparents, and they're not here. And so kind of adopting them as my own, and some of them like actually want to be called grandma or grandpa. And so it helps me and it helps them. If you're coming in, hey, grandma, and, they say, hey, and that kind of trust, that's, I think, one of the things that's really helped.
And do they ask about your story?
They don't actually. And it's funny because they'll just say, hey, kiddo,
Yeah.
And I'm like, hey, grandma. And, you just kind of talk. You just kind of,
right.
You're there for them. And so sometimes they do, think that you are their family. And you're like, okay, I'll just go with it, and they'll tell you this and they'll remind you to pick up the kids and they'll remind you to take them to church and, make the pies or whatever. And you're like, sure, will. No problem. I will do that.
But you're right. You're there for them.
Right.
Right.
And it's the most beautiful thing because at least we get to be there. Right. And even though I might not, right now with everything going on, we are, risking that safety where, obviously we're not going to wear a hazmat suit or anything like that. You can't really keep that 6 feet that's 6 feet apart. You just have to be okay with, hey, if you want a hug, I'll give you a hug. But, obviously I'm still going to ensure your safety by doing whatever I can. They can't all be in the dining room at the same time. It's, certain numbers. And so I think our facility has done a really good job of enforcing as much safety as possible because I'm not going to not say if someone asks for me to hold their hand, I'm not going to not do it,
Especially the patients that you're working with.
Right.
So when you look, whether it's across, Kansas or across the country, and you see your fellow DACA recipients contributing to the healthcare, not just even to the healthcare workforce, but really to the response and the recovery to COVID-19, what comes to mind for you?
I just think about how amazing they really are. That, risking your life to go to work because, one, you do have a work and you're considered an essential worker, whether it be at the hospital or whether it be on the fields. You are what is keeping America going, And so just that praise to them and, fellow immigrants and fellow undocumented people, the hard work is never going to stop. A pandemic is never going to stop the hard work either. They're going to get up every morning. We're going to get up every morning and continue to do our jobs. And I just think that's beautiful. I don't even know. It's amazing to see so many people rising up from this and seeing, even though it's not the best thing that's happening to our world right now in this country, the people that are still getting up every morning with a positive outlook and just wanting to help people and wanting to serve people, it's amazing.
And what do you wish that the average American knew about, whether it's yourself or anyone else who is a DACA recipient at this moment in time?
I just wish that they knew that, we'd be willing to risk it all. Just, kind of like, I wish I could do the things that I'm doing for my family who are not here in this country. I'm doing it for everybody else's grandparents and everybody else's family members. I just wish that, they understood that it isn't just, it's not a political issue, it's a humanitarian issue. It doesn't have to be that political. And I feel like right now that's what it is. That's kind of why it's so divisive. I just wish that people knew that we really just want to continue to work, continue going to school, helping our communities and our economy, because it's what we're doing. It's what we've been doing from the beginning, ever since we were able to get DACA.
So go back to that day in August of 2017 when the president said that he was going to rescind DACA. When you look back on that day and kind of what you've done since then, what the community has done since then, what the community is doing now, let's say you had 2 minutes with the president, what would you tell him?
Oh gosh, that's a very good question. Man, I would tell him that dreamers will willingly step up to the plate to keep you safe during this pandemic, even if you don't want them to be safe from deportation. And I really hope that you would listen to all of our stories and listen to the fact that we are members of society that have just been wanting to be accepted. There's so many things that I wish he would know. And, for him to know also that, my silence is not what's going to help me out here. It's going to be my advocacy and my voice so that other people can also have a voice.
So as you know, I have a final question, but I'm going to switch it up because you know what the final question is.
How are you going to switch it up?
Not a big switch, but just a small one. So instead of only in America, ... only in Kansas, ...
Ooh. Oh my goodness. It kind of changes things. I could talk about the sunflowers and all the amazing sunsets. Only in America. Oh, no. See, there I go with America. Let's see. Only in Kansas will you find people willing to do what's right for others. But that's not true because people do it in every state.
But let's go with Kansans do it better, right?
I was going to say, that's so biased against one state.
So do you want one more try here, or are you throwing in the towel?
Only in Kansas will you find that resilience is power. There, I kept it short.
Oh my, though. First of all, Esmeralda, thank you so much for not just for the time to talk, but for sharing your story, for your advocacy, for the powerful voice that you bring to the issue, but for everything that you do. It is so inspiring that all that you do. You're raising a family, you're taking care of family members, working multiple jobs in service of others. So just a heartfelt thank you. It's a real honor to know you and to see you as a friend. So thank you.
Thank you so much. And I'm just hoping to, bring more people together for an open dialogue on racial issues and immigration issues and problems, because, together we can overcome that racial bias and everything that comes with it, to truly think about the kind of world that we want to set up for our children. They are the future. So we kind of have to put that foundation down for them. And I just want to do my part.
Esmeralda Tovar is a mental health case manager and a medication aide at an assisted living facility in Kansas. You can find more information about Esmeralda at our website, immigrationforum.org/podcast. Are you enjoying our series, Keeping Us Healthy? Do me a favor, head over to Apple Podcasts to subscribe and leave a review. We would really appreciate it. Tune in next week to hear about how temporary protected status recipients are working to keep us healthy. Only in America is produced and edited by Joanna Taylor, Megan Wetmore, and Becca Wall. Our artworks and graphics are designed by Carla Leha. I'm Ali Nirani, and I will talk to you next week.